Weekend Clinic Lab Overview. This is a quick look into the Weekend Clinic Lab. You should find everything you need to perform all testing in here. Remember to sanitize your hands before and after testing and then use a designated clean sink. Both of the machines used are on the counter. All test kit supplies are on the shelves above, along with quick reference guides and how to do testing. There are also collection devices and swabs on the shelves too. The gonorrhea and chlamydia swab look like this and are only for oral, rectal, and endocervical collections. No penile swabs will be done on the weekend. On the top shelves, you will find the Weekend Clinic Lab policy and procedure books and the result book. Policy and procedure book is where you would look to find all the information about testing. Located on top of the refrigerator is a quick reminder sheet that also has contact numbers for lab staff if you ever have questions. Now for a look into the result book. It is divided into different sections based on testing. And behind all the result sections, you will find an area for the maintenance log and an area for the correction action log. On the corrective action log, this is where you will document any issues and how you resolve them. This is a continuous sheet, so no need to start another one until it is full. And behind this, lastly, there is a section with the master copies if you ever run out and need to print more. Next, we will talk about the patient accession log. This is used to log all samples brought and tested into the lab. This will be located on the counter and should be used daily. Now to go over the maintenance log. This must be filled out daily for both Saturday and Sunday. There's an area for 2 refrigerator temps, the room temp, the room humidity, and an area to document cleaning the Clinitec table, and an area to document cleaning the lab area. Both Saturday and Sunday must be completed in full with the date and the name of the person doing the testing. At the bottom, the lab staff will document the monthly cleaning of the Clinitec white bar, as well as when they review the maintenance log on Monday. At the refrigerator, you will find 2 thermometers with labels showing which is 1 and 2 to be able to record temperatures. If the temperatures are out, adjust the temperature and be sure to document this on the corrective action log. If the temps do not come in, you should then use the refrigerator in the main lab. On the countertop, you will find the room temperature thermometer and humidity. Now for Weekend Clinic Lab sample processing. This is a demonstration on how to collect a urine culture. You will need the gray urine culture tube and the transfer straw. Always be sure that the culture tube is in date prior to use. You will start by uncapping your properly labeled urine sample, and then your urine transfer straw. Be sure to open the transfer straw with the plastic opening at the top, as you want to be sure not to contaminate the white straw that will be placed in the urine. Also be aware that this urine transfer straw is considered a sharp and does need to be disposed of into a sharps container. Firmly press the gray tube on top of the clear opening to allow for the urine sample to be drawn up into the gray tube. Then carefully remove the gray tube and be sure that your urine sample did reach the minimum fill level, which is located here on the gray tube. Then you will dispose of the transfer straw into the sharps container. And recap your urine and place it in the refrigerator. Be sure to label the urine culture tube with at least 2 patient identifiers, along with the date of collection and the initials of the person that prepared this urine culture sample. Then your urine culture tube can be placed into a biohazard bag and put on top of the refrigerator in the black basket. Now for the urine, gonorrhea, and chlamydia collection. You will use this pre-packaged yellow collection device and a properly labeled urine sample. Inside you will find this GeneXpert CT-NG tube with a dotted fill line. The expiration date is at the top of this label. You will also find a sterile large pipette used to transfer the urine into the tube. To get started, you will want to uncap your urine and then open your pipette, being sure not to expose the bottom part of the pipette, as you do want to keep this sterile. Then you will unscrew the cap for your collection device. Please be aware that this collection device does already have liquid in it, so be sure not to spill. And now with the pipette, you will draw up a large amount of your urine sample, and being aware of where the dotted line is on the collection tube, you will dispense the urine up to this dotted fill line, and then recap your tube. You will then want to mix the tube a few times to make sure that the preservative is mixed in well. Once this is done, you will want to recap your urine and place it into the refrigerator. Now you'll want to label your urine, gonorrhea, and chlamydia tube with at least 2 patient identifiers, as well as the date of collection and the initials of the person setting up this sample. And lastly, you will place this urine tube in a biohazard bag and put it in the refrigerator for the lab to pick up on Monday. And now to show the molecular COVID, flu, and RSV swab. This will be a pre-packaged bag, and it can also sometimes vary in color. At the top of the label is the expiration date. You will also find the appropriate nasal swab that should be used for collection. After collection and proper labeling, please place them back into the biohazard bag and in the refrigerator for pickup on Monday.